We're extremely excited that we received our first doses of Moderna's COVID-19 vaccine. This represents for us a new phase in the fight against COVID-19. Right now, the Fairfax County Health Department is vaccinating community healthcare providers as part of Phase 1A, and we follow guidance from the Virginia Department of Health and from CDC about who we vaccinate and when. So in Phase 1A, there's two parts. First, the hospitals began vaccinating last week with vaccine that was delivered to them from Pfizer, and those vaccines are designated for individuals who are working in a hospital setting, performing healthcare or allied health roles, and working with patients who may have COVID or are known to have COVID. The Health Department and health departments around the country are working on the other part of Phase 1A, which is community healthcare providers who may not be seeing patients in a hospital setting, but are still seeing patients in the community, and they're performing healthcare on a daily basis. So we're working through Phase 1A, and we will be for the foreseeable future. Once we move out of Phase 1A, because we have ample vaccine availability nationally, we'll move to Phase 1B. And Phase 1B is looking at individuals who are 75 or older and who are working in essential frontline roles. And those are guidelines put forth by CDC for state and local health departments to follow nationwide. Once we move out of Phase 1B, we will move to Phase 1C, which is likely going to be individuals who are having comorbidities or other medical conditions that make them a little bit more at risk of developing severe COVID. We received Moderna's vaccine earlier this week, and it requires cold temperatures, but not ultra cold temperatures. So as many people have seen with Pfizer, that vaccine requires ultra cold temperatures, which require additional PPE and other handling restrictions. With Moderna, we do not have that restriction. So we're able to have the vaccine a little bit more readily available to community providers, and we're able to move it about the county to meet people where they are. So one of the pillars of public health in this country is ready access to vaccines, and the COVID vaccine is no different. We know that by getting vaccinated, you are decreasing the chances of acquiring COVID, and if you do acquire COVID, it decreases the chance that you'll develop severe illness or ultimately death. There are a couple things to note with COVID vaccines. Number one, while they were developed and moved to market quickly, no shortcuts were taken. So these vaccines were developed the same way that other pharmaceuticals are developed, and so we know that they are safe and we know that they are effective. In addition, for Pfizer and Moderna vaccines, individuals are required to receive 2 rounds. So you will come in, you will get your first round, and the prized vaccine information card, which individuals will take with them after they've received their first dose, and it will contain their return date as well as the manufacturer and the lot number, so that they know what manufacturer they need to have on round 2 and when that round 2 will be. And it's very important that people come back for that round 2, because we know that the effectiveness and the coverage provided by a vaccine is greater if you've been vaccinated twice as part of that initial campaign. So we really don't want people to only do it halfway. We want them to come back for round 2. So if individuals in our community want to learn more about the COVID vaccine campaign here in Fairfax, they can go to our website and they can find up-to-date information about all of the vaccines being offered in the county, as well as availability and phasing like we talked about. In addition, we have a call center that operates 7 days a week, so if individuals have questions that they would like to talk to someone from public health about, they're welcome to call our call center and get an answer from someone on the phone.